In an era where AI is often seen as a helpful tool for simple tasks like restaurant suggestions or composing emails, a more serious concern is emerging: its potential to mislead on critical issues like health. And this is the part most people might overlook. AI's advice, while convenient, isn't infallible or automatically safe, especially when it comes to medical matters. Take, for instance, a recent case where an individual ended up hospitalized after following an AI-generated health plan. His journey began with a simple goal: cut back on salt to improve his well-being. Like many of us do in the digital age, he turned to ChatGPT for advice on suitable substitutes. The chatbot suggested sodium bromide, a chemical compound that, while related to sodium chloride, table salt, isn't normally used for culinary purposes. In fact, sodium bromide is primarily employed in medical or industrial contexts, such as in hot tub cleaning or as an anticonvulsant in veterinary medicine. But the AI didn't clarify this critical context, leading the man to order the chemical online and include it in his diet. Fast forward 3 months, and he arrives at the emergency room with symptoms of paranoia, hallucinations, both auditory and visual, and jagged thinking, believing his neighbor was trying to poison him. The medical team described his condition as worsening paranoia and hallucinations that led to an involuntary psychiatric hold due to his severe mental state. Once treated with antipsychotic medication, the patient was stabilized enough to explain his self-directed dietary experiment. This vital piece of history, combined with lab tests, revealed he had bromism, a toxic buildup of bromide in his system. Normal bromide levels in healthy individuals are below about 10 milligrams per liter, but his levels soared to 1,700 milligrams per liter. Bromism isn't a new or obscure condition. It was quite common in the early 20th century, at one point responsible for up to 8% of psychiatric admissions. However, with the decline of medications containing bromides during the 1970s and 1980s, such cases largely disappeared. After 3 weeks of treatment, he was discharged without significant residual issues. Yet this isn't merely about reviving an outdated disease. It highlights a broader problem. AI, as it currently stands, cannot replace the nuanced expertise of healthcare professionals in matters of real consequence. The authors of the case study caution that AI like ChatGPT can generate inaccuracies, lack critical thinking, and sometimes actively spread misinformation. Even as the AI suggests seemingly harmless options, it doesn't have the ability to assess their safety or relevance in real-world contexts. It's highly unlikely that a seasoned doctor would have recommended sodium bromide to someone looking to substitute salt, underscoring the importance of human judgment in medicine. This eye-opening incident was documented in the journal Annals of Internal Medicine, Clinical Cases, serving as a stark reminder that while AI can be a helpful assistant, it can't and shouldn't stand in for expertise when lives are on the line. Do you think AI will ever be trustworthy enough to handle such critical decisions? Or is this an inevitable danger of unchecked reliance on technology? Share your thoughts. Are we rushing into a future where machines decide our health without enough oversight?